Hello. In this last screencast for week number 1, I want to illustrate to you how you can get numerous papers published from one main epidemiologic study. So, how can one study have numerous research questions and papers? That's what I've titled this. So let's explore. Now, obviously, you haven't had any exposure to different study designs yet, but what we'll see from this particular scenario here is I was able to do a variety of different things. The primary purpose of the overall study was to look and see if preseason functional testing, if that can identify athletes at risk for injury. So during 2017, I invited 6 teams to our lab at George Fox University. There was a D2, 2 NAIA, and 3 Division III teams. I also collaborated with some friends at Azusa Pacific University, so they were able to collect measures from their school. They were a D2 school also. And I had collected data from George Fox volleyball players the prior 2 years. So overall, I got about 130 athletes. Now, here are the tests that we used. We did diagnostic ultrasound imaging of each patellar tendon. Then people would perform the Y balance test for the lower quarter. They would do the standing long jump and single leg hop tests. They would perform the drop vertical jump from a 1 foot and 2 foot box in our motion capture lab. And they would then finish up by performing the lower extremity functional test, which is an agility drill test. Now, on this slide, I've got an arrow from the standing long jump and single leg hops to that little snippet from a paper I published in the Journal of Sport Rehabilitation in 2020. So previously, I had found that lower scores on the standing long jump and the single leg hop test were associated with a greater risk of injury. So another nice aspect of this study, see, that was on a sample of 82 subjects. On this sample of 130, now I'm able to see if that risk factor potentially could be validated again. So what did I find from this table here? If you come down here, basically individual test scores were not associated with a greater risk of injury. But if somebody had a standing long jump less than 80% of their height, if bilaterally each side, their single leg hop was less than 70%, and if there was a single leg hop side to side asymmetry greater than 10%, then individuals were 4.6 times more likely to have a non-contact time loss injury to the lower quadrant and 6.3 times more likely to experience a non-contact time loss injury to the ankle or foot region. Recall, though, again, my primary question: can preseason functional performance tests discriminate injury risk in a cohort of female collegiate level volleyball players? So, what was I doing? I was getting people prior to the start of their season. They were all free from injury. And so I was conducting a prospective cohort study. You may be familiar with that term, and again, we'll go over that again later in the term. The primary statistic was the relative risk statistic. And again, we'll go over those and describe what those are, but there were also some other stats that were used. So my first paper was inspired by this one by Cook et al., published in 2000. And they found that elite junior basketball players who had imaging using diagnostic ultrasound imaging of their patellar tendons, if they were presenting as having what looked like patellar tendinopathy even though they were asymptomatic, those individuals with abnormal imaging had a greater risk of going on to develop symptomatic patellar tendinopathy. So that would be really interesting if you could identify people just from their imaging. How helpful could that be to the athletic trainer at a university? They could quickly do the imaging, see if somebody was at risk, and then get them on an intervention program. Well, we didn't find that to be the case. So we had 120 some athletes that completed all of the imaging studies. And so what we were able to do is we were able to report the presence, that prevalence of patellar tendon abnormality as identified on an ultrasound image, but we weren't able to report an association between the preseason presence of patellar tendon abnormality and the increased risk of developing symptomatic jumper's knee. Now, in this particular paper, we had both the prevalence side showing that percentages, the percentages at baseline, and then since we followed people into the future, we were looking at incidence. So we reported the relative risk, again, also known as the risk ratio. Why did our study not find anything, but this one did? Well, it's possible that this one did because it had a really small sample size, about half the sample size as our paper. And as we'll learn about the 2x2 tables and so forth, basically, if an injury had occurred in a different group, if the person didn't get injured that was at risk for injury, or if another injury had occurred in the group that was not at risk, there would not have been a significant result in this study. Another thing that they did is they followed people for 18 months. Whereas this particular paper, we just followed them for the course of that season, so about 4 months. So again, potentially another reason why there may have been a difference in us not finding anything. Recall, I had people perform the Y balance test, and I like sharing this because a former Rocky Mountain University Doctor of Science student, Phil Plisky, he for his dissertation while at Rocky Mountain University, he did the Star Excursion Balance Test and found that performance on the Star Excursion Balance Test was a risk factor, potentially, if people had poor performance of lower extremity injury in high school basketball players. But what was innovative is he recognized that the poorer scores occurred in the shape of a Y. And so he innovated and created the Y Balance Test Kit. And so, if you're a physical therapist, if you're an athletic trainer, you're probably aware of this device. And that comes from the work that Dr. Plisky did as a student early on at Rocky Mountain University. So, we had a couple papers come from this. The top paper is basically a descriptive paper presenting test scores for female collegiate level volleyball players based upon competition level, position, and starter status. The lower paper down there is the prospective cohort side of things, looking to see if test performance was associated with a greater risk of injury, and it was not. Note that I also had people do the drop vertical jump from both a 1 foot and a 2 foot box in our motion capture lab. And I've got a fellow colleague who's doing some work on that, somebody that's got a PhD in biomechanics. So, yes, I definitely need help because I don't know it all. But what we were able to do with the help of the lab engineer was to get a reactive strength index score. And so, for those of you who aren't familiar with the reactive strength index, the drop vertical jump is one way that you can assess this, either with arms free or hands on hips. And what we're seeing here is the individual drop down and try to explode up as high as they can. So the reactive strength index is essentially a measurement of explosiveness or of plyometric ability. But what did we find? We found that individuals with a lower reactive strength score, and a lower score would be a score that's not as good, potentially. Those with a lower reactive strength index score were 4 times more likely to go on to experience a non-contact time loss injury in the lower quadrant region, so the low back down to the feet. We didn't find that at the 2-foot box, but the 2-foot box is something that we added in 2017. We didn't have that in the 2015 and 2016 cohorts. So it's possible that had we had a larger sample, we may have found that also. And the reason I say that is if you look at the all injuries column, what we're seeing there is that there were 14 injuries in the at-risk group and 2 in the lesser risk group. So we get an idea about the relationship between the percentage of injuries per group and the total injuries per group. Well, what do we see in the 2-foot box one? We see 11 injuries in the at-risk group and 2 injuries in the lesser risk group. So I am speculating that, again, if we had a larger sample, we would have gotten there. Now, even though it wasn't a primary purpose of my study, since I had this data, I could take a look and see, does reactive strength correlate with game performance? For those of you who are strength and conditioning professionals or who have looked at that research, you'll see that sometimes where different variables will be looked at. Does this correlate with that? Because it starts to give people an idea about things that they might want to consider for training purposes. We published a paper in the Journal of Athletic Enhancement looking at reactive strength index scores and the correlations with individual position performance. So over here showing outside hitters, and what we see is that there were many, in this case, low to moderate um, correlations between game performance and drop vertical jump performance, or I should say reactive strength. And then we also see that too down here with the setters. The setters had those who had better reactive strength index scores had a moderate, there's a moderate correlation between kills per set and being a setter. Now, looking at the standing long jump and single leg hop. So recall, I published a paper in 2020, and we found that those individuals who had lower standing long jump, lower single leg hop scores bilaterally, and an asymmetry had a greater risk of injury. And so wanted to see with this new cohort, does that stand up? This is a very important thing because you will see all the time, especially for those of you who are physical therapists and athletic trainers and you're interested in kind of the sports injury epi research, you'll see something published that shows that individuals were at a greater risk based upon X, Y, or Z. But what happens a lot of times is those authors don't do a validation study, or if a validation study comes, it comes 5 years later, and people have kind of, they're kind of entrenched in doing what they do. And a perfect example of that is the functional movement screen. The functional movement screen, we won't go over it now. We may go over it later in the term. Basically, it is a series of 7 movements, and you score those movements, and depending upon their performance, they may be based upon one study at a greater risk of injury. However, there were lots of flaws to that study, and you couldn't generalize those results to all populations. What has happened since that paper came out, there's been numerous studies that have shown that the FMS does not work as a tool to screen athletes. And unfortunately, though, you continue to see the FMS used in that capacity. So again, this was the data from our first study. What did we find? Well, we published in Physical Therapy and Sport, and it's a slightly different. People with lower standing long jumps, lower single leg hops bilaterally, and a prior history of injury, those individuals were 3 times more likely to go on to experience a non contact time loss injury during the season. Are there correlations between preseason functional performance tests and game performance? So this is kind of similar to looking at the reactive strength index. We just happen to look at all the other tests like the left, like the hop and jump tests, and there were some small to moderate correlations here or there. Now this last one here, this one here is a result of years of data collection. And so this particular study looked at 100 and some volleyball players, I think 100 and some women's basketball, and right around 100 soccer players. So we had over 300 athletes. These are all female athletes, and was looking to see if prior history of an anterior cruciate ligament reconstruction is associated with a greater risk of a subsequent injury. So I always would ask people what their prior injury history was. I went through the data, found all those individuals who had an ACL reconstruction, and then was able to run the analysis to see that if you had had a prior history of ACL reconstruction, you were at 6 times greater risk of having a subsequent ACL while in college. So again, the whole purpose of this discussion here was to illustrate for you that if you have one kind of initial idea, and going back to the start here again, my initial idea was I want to look and see if these preseason functional tests can identify athletes at risk for injury. From that, I was able to have prevalence data in a paper. I was able to publish several prospective cohort studies looking at different tests. I was able to also publish some correlational studies. So this type of research can be very fruitful. And if you have ideas and are curious about where you would want to go or how to go through things, I would love to talk to you about it.